And now I call upon Dr. Richard GALE. He's going to talk to us on shifting the curve with Aflibercept 8 milligram in diabetic macular edema, 156 weeks data from the PHOTON trial.
Thank you very much, dear Chair, dear Conference, and dear Bayer. Thank you very much for the opportunity to continue on the discussion from Michael's excellent talk titled Shifting the Curve with Aflibercept 8 milligrams, with a particular focus on the 156-week data from the PHOTON study. Please note my financial disclosures. So I'm going to spend a little bit of time talking about the key aspects of the PHOTON study, which was designed to explore how 8 milligrams could gain better outcomes from a higher molar dose of Aflibercept. And some key aspects here that this was a randomized controlled trial, multi-center, phase 2-3, in both previously treated and treatment-naive patients with diabetic macular edema. They were randomized 1 to 2 to 1 in the following groups. And this is a really important aspect. So after 5 initial 2 milligram monthly doses, the first arm continued on with 8 weekly doses. The 8Q12 doses arm had 3 monthly doses and then continued on at 12 weekly. And the third arm had 3 monthly 8 milligram doses and then continued on at 8 weekly. And the concept was the primary endpoint was non-inferiority at week 48. The end of study was week 96. But this talk is going to focus on the extension study through week 156, the optional extension study. So let's just recap how the study got on out to week 96. So through year 2, PHOTON achieved good, lasting visual gains with rapid and resilient fluid control with extended treatment intervals. And what I'd like you to notice on the right-hand side in particular is the reduced burden, which is very important for our patients and healthcare systems, as Michael mentioned earlier, with 7.8 mean injections at year 2 for the 8Q16 group compared to 13.8 with the 2Q8 group, and an even lower number of injections in the second year. Now, I'm going to explain details about the extension study. So the concept is that all individuals who entered this were moved on to 8 milligrams. Those in the 2 milligram group were switched to 8Q12, that's 12 weekly initially. And the 8 milligram group was switched to a regimen of their last assigned treatment interval. So just to be very clear, individuals were seen on a monthly basis on 3 occasions after the switch, and then quarterly assessments were made. There was the ability both to reduce or extend the treatment criteria in the so-called EDRM criteria. So for shortening, individuals would have a greater than 10-letter loss and an increase in greater than 50 microns of central retinal thickness, or greater than 15-letter loss. And to reduce the interval, individuals would have had a less than 5-letter loss with a really quite dry central thickness. That's less than 300 or 320 on the spectralis, compared with the new reference point. So let's see how they got on. So we can see here that there was lasting vision gains, which is sustained and meaningful and extended through year 3. So we can see week 48, the improvement in visual acuity with the 2Q8 and the 8 milligram groups. This was sustained out to week 96. And take particular attention now of the extension, where these gains were maintained through 156 weeks at around about 8 letters in both arms. So the mean number of injections was reduced, particularly in that third year, with the 8 milligrams requiring 3.3 injections on average. Let's have a look at the central retinal thickness now. So this is the 8 milligram group, and we can see, as anticipated, a rapid reduction in central retinal thickness, sustained out to year 1, and likewise out to week 96. And furthermore, this continued with an improvement numerically out to week 156. Now let's have a look at the 2 milligram group, and this is really quite interesting to spend a bit of time on. So typically we see the reduction in central retinal thickness and this seesawing effect that we've been used to over time, with a general trend to increasing the central retinal thickness. Now concentrate on what happens when the first 8 milligram is given after week 96. We see a further reduction in central retinal thickness. In fact, the largest reduction following the initiation of around 54 microns, and then a slower return to the increase in central retinal thickness. And that to me speaks to increased power and durability of the 8 milligram molecule. And this central retinal thickness was maintained out to week 156. And what does this mean? It means for our patients that there were extended treatment intervals such that the last assigned treatment interval for the 8 milligram group was around about 16 weeks or more in 7 out of 10 individuals, and in fact 20 weeks or more in around half of individuals. In the 2 to 8 milligram switch group, around 80%, 8 out of 10, achieved intervals of 12 weeks or more as assigned at week 156. Now, it's really important for us to concentrate on the safety profile of the molecule and the dosage as well. And I was pleased to communicate here that the safety profile of the Aflibercept 8 milligrams was comparable to that of the 2 milligrams through year 3. It's really quite important that we have a focus on intraocular inflammation. And there were low amounts, a few percent, which were equally balanced across the group. Furthermore, with a higher dose, it's important to study the APTC events, for example, heart attacks and strokes, and we see that they were balanced and comparable to that of Aflibercept 2 milligrams through year 3. So in summary, the photon extension had 3 key findings. It produced lasting visual gains with 3 initial monthly doses and extension thereafterwards. We reviewed a rapid and resilient fluid control through week 156. And very importantly for our patients and healthcare systems, on the right-hand side are the extended treatment intervals. 7 out of 10 patients had a last assigned treatment dose of greater or equal to the 16 weeks, about half greater than equal to 20 weeks, and around 8 out of 10 patients greater or equal to 12 weeks at year 3. I'd like to thank you for your attention.
Thank you, Dr. Richard, for giving us what, in fact, everybody, all of us are looking forward to, what the photon trial and the extension has to kind of what you have, the way you have summarized the whole thing. I think it clearly shows the differences between 2 milligram and 8